Medical resources affect the physical health of Hong Kong residents. However, the accessibility and affordability of medical services in Hong Kong are always reported to be unsatisfactory. Thus, this video intends to clarify the underlying causes and propose to improve this situation.
In terms of public medical resources, there are two causes of low accessibility: medical facility mismatch and the lack of medical staff. In the three graphs, dots of different colors show the distribution of hospitals, health centers, and clinics. The darkness level shows the population density in different areas of Hong Kong. The two blue boxes emphasizes Sin Yi Island and the Eastern District, where the population density is high, but the level of medical facilities is low, which shows a mismatch between the residents' demand and the government's supply of medical resources. As we can see, in several hospitals, the patients have to wait for 7 to 8 hours before getting treatment, which shows the high gravity of this mismatch. Meanwhile, we compare the number of the elderly and medical staff. The elderly population increased by 260,000 in the 10 years, but the number of medical staff only increased by 30,000. This graph showed the lack of medical staff in public hospitals. Then we consider private medical services. There are three factors of affordability: high service charge, low disposable income, and small insurance coverage rate. First, in this graph, service charges in private hospitals are much higher than those in public hospitals. The inpatient fee is around 5,000 Hong Kong dollars in private hospitals, as opposed to 120 Hong Kong dollars in public hospitals. Second, from this diagram, Hong Kong residents' median monthly wage is 18,000 Hong Kong dollars, but the ICU fee is 15,000 Hong Kong dollars per day. In other words, an ordinary Hong Kong resident needs to spend 80% of his monthly income to stay in ICU for one single day. Third, the small medical insurance coverage rate makes the situation even worse. This graph indicates that only 20% of the elderly have medical insurance. Thus, most vulnerable elderly cannot afford high service charges in private hospitals. Even if they can afford the medical insurance, the overall proportion of inpatient fee covered by medical insurance is low in both 2016 and 2021. Focus on this transformation. We can observe that the 0% circle becomes greater. The point is, for more and more Hong Kong residents, 0% of their inpatient fee is covered by medical insurance. Many people still have to spend their own disposable income on medical treatment, which is quite expensive. To sum up, the two main problems are low accessibility of public medical resources and low affordability of private medical services.
To solve these two problems, we suggest three methods of using government health expenditure more wisely. First, to increase the number of medical staff, we suggest recruiting talent from mainland China. In this bar chart, the average base salary of a doctor per year in mainland China is far lower than that in Hong Kong. Thus, instead of raising the salary to retain original doctors, the government should implement policies to attract mainland doctors with the existing amount of salaries, which can help save health expenditure. Although Hong Kong has been accepting non-local doctors, this chart indicates that the exam is too hard for non-locals to get certificates. So the government needs to loosen up the restriction on importing non-local doctors. In the next place, to further improve accessibility, the government may use the budget to build more hospitals and reallocate doctors according to the population density in great need of medical resources to eliminate the mismatch. For example, Sin Yi Island and the Eastern District should have more hospitals and doctors, according to this map. Last but not the least, to enhance the affordability of private medical services, the government should advertise more to encourage people to buy existing medical insurance products like voluntary health insurance schemes. Besides, the government may use the tax incentive policies for firms that provide employees with highly covered medical insurance. In conclusion, these are the three proposals, and we sincerely hope Hong Kong's medical service can be improved to benefit Hong Kong citizens' physical health and well-being. Thanks for your watching.